who have died as a result of COVID-19. So as of this year, of the 119 deaths that are occurring within the city of Houston, 27 of that 119 are associated with nursing homes and 2 associated with the Harris County jails. The 2 new deaths that we are reporting today are a Hispanic male in his 70s with underlying health conditions who passed away on May 14th, and a non-Hispanic male with unknown race in his 70s with underlying health conditions who passed away on May 17th. As more people return to work, to the gym and restaurants, we are increasing public access to COVID-19 mobile testing sites. And before the month is out, we will have 24 testing sites across the city of Houston. I also want to give special recognition to Walgreens, who is meeting the needs of our community. Tomorrow morning at 9 a.m. Thursday, Walgreens will open an additional drive-through testing site. This site will be at the existing store at 8301 Broadway Street at Belford. That's 8301 Broadway Street at Belford. People 18 and older with or without symptoms can get tested, and to make an appointment, visit the Washington.com website, the Washington.com website. And if I'm not mistaken, what did I say? Oh, Walgreen, yeah, Walgreen.com website. And if I'm not mistaken, at this testing site, I believe you can get the results in 15 minutes. Is that correct, Stephen? 15 minutes at this? Yeah, in 15 minutes. So this is that particular testing site. Over the past week, the city of Houston has recognized those individuals and companies that have stepped up in times of crisis and urgent need. Ramco makes it a point to step the city of Houston to help with expanded mobile testing in underserved communities and support for first responders. And I want to thank them for doing that. In total, In total, Ramco has donated over $1.5 million to the Houston area for COVID-19 response. This includes donations for Houston Methodist to developing a promising treatment for the coronavirus, and for the Houston Food Bank to continue to help communities in need. Another $500,000 were donated to food banks to various cities in the United States. In fact, Ramco's entire team was out yesterday at a food distribution site for families in District A. And during Hurricane Harvey in 2017, the company supported recovery through volunteerism and major donations to the city's relief fund, schools, shelters, and housing initiatives. And that work continues today as they are supporting the rebuilding of a library. I want to thank Muhammad Ashamari, President and CEO of Aramco, for their generous support to the Houston Food Bank, not just in this city, but in other cities, but especially to the $600,000 that they have contributed to increase testing in underserved and under-resourced communities. Please give it up to President and CEO Muhammad Ashamari. He's very shy. He doesn't want to say too much today. You know, I may call on him anyway. Let me also recognize Kathy Easter, President and CEO of Houston Methodist International, and I want to thank her and them for their generous support to also the city of Houston. Kathy Easter, thank you, Kathy. The reality is that everything that I want to acknowledge also, there's Amy, and I'm going to get these names wrong, Amy Kambaji, Director of Brand Strategy. This is also at Aramco. Heather O'Connor, Supervisor of Communications. I've already indicated Kathy Easter, President and CEO of Houston Methodist International, and Robin Mansour, President and CEO of Houston Health Foundation. Again, I want to thank all of our partners who are working with us in the city of Houston to advance the needs and interests of the city. Wanted to keep it short today, and I'll take any questions or comments anyone may have at this point. Yes.
Hi, I have a quick two-part question. First, can you lay out the city's recommendations for wearing face masks? And then second, can you say what officials have seen is really the culture around wearing face masks in Houston?
Okay. Essentially, whether they're face masks like the one that I have on, or face coverings, which one, like Mayor Pro Tem Martin has on, the key is to cover one's nose and one's mouth. And we wear them to protect other people from ourselves, because it's been indicated that anywhere between 25–30% of people who are carrying this virus are asymptomatic. They're walking around with no symptoms. They feel great. They don't have a fever, don't have a cough, a tightness of chest, but they are still very much infectious. And so the purpose of wearing the mask, the face covering, as we say mask up, is to protect other people from you, especially when you are out and about other individuals. So that's the purpose, combined with engaging in social distancing and proper hygiene, washing your hands or using hand sanitizer, things. All of those things will help to reduce the spread of this dreadful virus.
Can you say what officials have seen around the city? Are people heeding the advice to wear masks, or is it varying in different areas?
Well, let me just say, in the months of, I think towards the end of March, April, people were heeding it. I think people were responding, because, there was a lot of attention was given to how quickly this virus was spreading, the community spread, and people saw how the cases were spiking and the number of people were dying. And so what we have noticed in the month of, let's say, towards the end of March and April, people were wearing the face coverings. They were engaged in social distancing. They were staying at home. Now what we're seeing is that, I would say it's on and off. People are not wearing them as much, which is unfortunate. And that's why we're putting forth an extra push to encourage people to mask up, to put on masks or face coverings, because the very same things that we needed to do in March and April, the beginning of this month, to flatten the virus, are the same things we need to continue to do in order to keep everyone safe. Let me stop and let me ask where's Dr. Peirce? He may want to elaborate on that a little bit more.
Thank you, Mayor. And the Mayor's got it exactly right. Remember, the purpose of the mask that we are wearing, everyone in this room is wearing a mask with the exception of our sign language interpreter, that protects the ones around us. So it's important that people understand that if you want to do your part to support the society and support the community and support the economy, then you need to be wearing a mask. Because for those individuals, the large percentage that we've noted that are without symptoms and don't know that they're infected and are spreading it, the people who become infected, they're going to wind up testing positive, they're going to wind up getting ill, they're going to wind up being in the hospital, and we'll see the numbers come up. The problem, though, to keep in mind is that is delayed. So between the time when somebody inadvertently spreads the virus to somebody else, who then generally inadvertently spreads it to several other people, by the time that we see the numbers ticking up, we're going to be way behind on that. So it's really important that people wear the mask, social distance, do all those things that we've been asking folks to do. That's the only way we're going to stay ahead of the virus. It's very important that people understand really, it's the physics of the virus that you have to understand.
Thank you.
Mayor,
Yes.
I had a question regarding your tweet last night regarding your thank you to the Justice of the Peace for postponing evictions
Yes.
from May to June. Are all 16 on board with doing so? Could you expand?
I can't say if all 16 are on board. Some of them are doing it. I know I talked to Judge Joe Stevens, for example. Certainly he's doing it. And we're talking about specifically people who have gotten behind because of COVID-19. We're not talking about, for example, individuals who may not have been paying their rents in December, January, and February, okay? But people who specifically who have gotten behind. So some of the judges are doing it. Hopefully, more of them will do it. Hopefully, all of them will do it. And my tweet certainly was intended to encourage all of them to do it.
Do you know a number that have signed on to say yes?
That
we'll
I do
it?
know. I do not have a number. Okay. But my hope is that they all will do it. At least hold up on evictions through the month of May until at least the mid June. You know, and with these evictions, even if proceedings should begin, it generally takes about a month before you can go through the entire process.
Dr. Pierce, my question is related to cases and tracing, and I think that the head of the health department will be able to add to that. There are challenges which have to do with contact tracing, and some of those tracing cases are converted into cases themselves, and communication issues are involved. A lot of money is being pumped into that. We are getting 300 people to do this work. Can you actually speak to the challenges, and how are you addressing them? Are you training the new people that you are bringing on board for this temporal assignment? Thank you.
Yeah, thank you. That's a great question. So we're going to be bringing on board about 300 additional employees to do the contact tracing. And again, what that means is that when the labs report to us a positive case, that will come with some information about the individual who tested positive. Sometimes it's as little as a name and a phone number. We would prefer if we got the entire form was filled out with an address and the date of birth and some other information. And then the contract tracers start off by finding that individual who tested positive. Now, ideally, that person already knows that they tested positive because the lab or their doctor has informed them, and hopefully the lab or the doctor who informed that they were positive already gave them some advice about how they need to isolate themselves and quarantine those who were close to them. Our contact tracers, which are going to be going through training, are going to be doing the epidemiology. So they will interview the person who tested positive to find out during the time from, and every case is different. So when somebody tested positive and or when they develop symptoms, we have to go back, depending on the particular story, a couple of days and start interviewing to find out who they may have been in close contact with. And we need to define and talk about what is a close contact to find out who we then need to contact and quarantine. And those folks, when we contact those we think are contacts, we need to find out if they're symptomatic. If they're symptomatic, we need to get them tested, and then the process repeats itself. So it's very complicated, it's very labor intensive, it's very time consuming, and it's going to take an army to do it, and this is the army of 300 that we're building.
Sure. I have a question on behalf of Univision for Dr. Peirce, if that's all right. They ask, does the Houston Health Department have any reports of the condition multi-symptom inflammatory syndrome in children in Houston?
So we talked about this last week, and as of this morning, I'm not aware of any cases in Houston. But again, we ask that the physicians in the community, this is a brand new illness, and the CDC has done a good job of trying to push the information out to clinicians, doctors, and nurses across the nation so that they'll be on watch for it. We've talked about it publicly so parents can be on watch for it. I am not aware of any cases yet in Houston, and let's hope it stays that way. And that's probably because we have, as a community, we have already done such a good job of keeping our numbers down. We need to continue doing that, or else, you know, that's one of the consequences if the numbers shoot up, is that children may become ill. So.
Sure. I have one question for the mayor. You mentioned nursing homes. The governor's mentioned nursing homes as a hot spot. We talked to Adrian Garcia today, who's concerned about nursing homes. Is that an area of concern even as the numbers begin to level?
Well, that has always been a concern because of the 119 cases I believe that the city has. I believe that's what I indicated, 119. 27 of that 119 are coming from the nursing home. People who have passed, people who have died. So almost a quarter of our death count, if you allow me to put it in that way, are coming from the nursing homes. So we are very much concerned with what's taking place in our nursing homes. We're also concerned with what's taking place in what we call senior living facilities. And certainly we'll move forward on the city's end to look at doing testing in the senior living facilities, and we're putting forth a plan to do that as we speak. But that is a keen concern.
Thank you all for coming. We appreciate it.
Thank you all very much.